Hi, I'm Dr. Steve Wynia, the Director of Physical Therapy at Brookdale Health. Today we're here to talk to you about a problem we see pretty commonly here in the clinic called Benign Paroxysmal Positional Vertigo. We're just going to call it BPPV for short. What this is, it's a problem with dizziness or vertigo. That's what that vertigo is. Paroxysmal means it's short-lasting. Positional means it happens when you change positions. If you suffer from vertigo or dizziness with activities such as getting up out of bed or bending down into your kitchen cabinets, you might have BPPV. We see it for two very common reasons. One is a degenerative process. The second is a trauma, such as getting in a motor vehicle crash or falling and hitting your head. This can be a real debilitating problem, real miserable. A lot of times people suffer with this for weeks or months before they get the right treatment for it. The good news is there's some real easy treatment for it. The problem exists in your inner ear, and it sounds kind of crazy, but what happens is there's crystals or rocks that kind of fall into the wrong part of your inner ear. This interrupts your equilibrium and the normal state of balance. All we need to do is reposition those stones or those crystals back into the right spot, and typically the symptoms go away.
You're going to look to the left 45 degrees. Go ahead and lay back. You're going to keep your eyes open, both knees bent, and look up. Now pick a spot on the ceiling and stare at it. There's crystals in the inner ear that I'm repositioning. They've moved. They've become dislodged. I'm repositioning them back into the inner ear, into a certain canal where they're supposed to be. Now I'm going to turn your head to the right. You look up, find a spot on the ceiling and stare at it. You dizzy? Mm-hmm. So now I'm positioning these crystals into a different canal. Doing okay? Mm-hmm. Getting better? Mm-hmm. Tell me when it's completely gone. Okay. And then in about 20 seconds, you're going to turn onto your right side and look down. Turn onto your right side and look down. Rest your head in my hand. Stay right in. Yeah. You keep that head rested. You really dizzy? Mm-hmm. Is this the worst one? Mm-hmm. Yeah. So now this is moving those crystals in the inner ear to a different area. Okay. Stay like this for 30 seconds. So then in 30 seconds, she's going to sit up and those crystals are going to position where they're supposed to be in that inner ear to decrease dizziness. I just took Rhonda through canalith repositioning to reposition those crystals back into the inner ear where they're supposed to be, to decrease dizziness that happens when you roll over in bed, when you get up, lay down, bend down. And this type of dizziness typically lasts less than a minute. And it's typically a couple treatments of canalith repositioning, which I just did with Rhonda, and it takes that dizziness away.